People think that you have to go to therapy and lie on a couch for months. In reality, you can go for a few sessions and learn some tools and leave with some really good coping skills.
Hi, I'm Piyali.
My name's Kristen, and I'm a licensed mental health counselor. And I've spent most of my career working in primary care. I've seen a lot of conditions, migraines included.
Why is it important for someone suffering with migraine to see a mental health professional?
There's a lot of reasons, and they're kind of individualized, so it depends what you're dealing with. You can feel very alone when you're dealing with something like a migraine, but if you're talking about it openly, then there's not as much shame involved.
Right.
Also, if you find that you're not into talk therapy or not into talking about it, oftentimes therapists have other types of modalities that can be really useful.
What should migraine patients look for in a mental health care provider?
I would look for somebody who is trained in any sort of behavioral therapy. Once somebody experiences a lot of migraines, there can be a depression, almost like giving up, hopelessness that can occur. And none of that has to happen. There's ways to manage the anticipatory anxiety, and there's ways to manage the emotions before you get to the depression. And if you're in the depression, there are ways to manage that as well.
For someone who's hesitant to go to therapy, what would you recommend?
Reaching out to therapists and finding a therapist that's a good fit. The relationship is almost just as important as the tools that you learn in therapy. People think that you have to go to therapy and lie on a couch for months and months and months. In reality, you can go for a few sessions and learn some tools and leave with some really good coping skills.
What are some of those coping strategies that migraine patients can use to emotionally manage their condition?
For instance, if they start to feel like, my daughter's birthday's coming up, I know I'm not going to be able to attend, there's ways to identify those thoughts and start to challenge them so that they don't get heightened and anxious before they get into that state. And there's a modality called acceptance and commitment therapy. It allows us to kind of accept where we are. And maybe it is lying down and putting a cold compress on, or maybe it is doing breathing exercises to make sure that you are calmer. And really, therapy does help you to understand what is going on in your body and understand the physical and emotional symptoms.
As a mental health care professional, what is the one most important piece of advice you would give to migraine patients?
To really understand what's going on in your body, both physically and emotionally, tracking your symptoms and understanding what the first sign and symptom of both the migraines are and whatever sort of stress and anxiety, depression you might be experiencing, and then coming up with a plan. So you have that plan in your back pocket, and you don't have to start to think about it when you start to feel like you have a migraine coming on or you're starting to feel anxious.